Essentially, facelift surgery is for gravitational aging. As we age, gravity takes a vicious assault of the face and things start to sag. And we look at age groups from about 40 to 70 years who would be prime candidates for this sort of surgery. But the key from my standpoint is if I stand a prospective patient in front of a mirror and stand behind them and pull the face up and back, and there's a discernible difference, and the patient is delighted and I'm delighted, then this patient is a candidate for surgery. The public is very aware now that there's different types of facelifts. There's a so-called SMAS, S-M-A-S facelift, and there's another type called a deep plane facelift. In my hands, probably about 10% of what I do is so-called deep plane facelift, typically reserved for older individuals who have a lot of sagging around the eyes and the lower face. And the other 90% of facelifts are a standard facelift where we're tightening up muscles, we're tightening up the neck, and then gravitationally reversing the changes in the skin. And for some reason, deep plane facelifts, which were big about 20 years ago, have re-entered the verbiage of patients, and everybody coming in wants a, quotes, deep plane facelift. The truth is, it's inappropriate for 90% of our patients. Why? It's a riskier procedure, it takes longer, there's greater complications, but in some people, we will do a deep plane facelift who fall into the age group who would benefit from it. But most patients require a standard tightening of muscles, tightening of skin, reversing the signs of aging, and it will perform very, very well for them. I perform all of my facelifts with the patients awake. Why? The results are better. The patient bleeds less. The results are way better than a general anesthetic facelift. You do not need drains. We give you medication to make you a little drowsy, and we use local to freeze you up. It takes probably 2 to 3.5 hours to do a procedure under local. What we typically would do is we tighten up the deep layers of the muscle, we tighten up the skin, we re-drape skin, trim out any extra additional skin, and very methodically and technically demandingly suture up your face. The incisions themselves typically run up into the temple area, top part of the ear, in front of the ear, down to the earlobe, back surface of the ear, across to the hairline and down. We make the incisions there, lift the skin up, and then we use very powerful deep sutures to pull the face up and back, as many as we need. And after we've done that, we re-drape the skin, trim out any excess skin, and we do that on both sides of the face. And sometimes we have to address the neck too, so we may make a teeny little incision just under the chin and address and tighten these muscles at the same time. After we've done that on both sides here, we wrap you like a little mummy, and hence the post-operative period begins. At the end of the procedure, you're wrapped up like a little mummy, tight dressings. Someone comes and picks you up, takes you home. You come back and see us 24 hours later. We take the dressing off. We reapply another dressing to you, which typically stays 3 or 4 days. You come back and see me again. We take it off, put another dressing on for a couple of days, and then you come in around day 8. We start to take stitches out. We take the remaining stitches out at around 12 days. Well, the first thing that I would say to you, despite what social media is suggesting, if you're under the age of 30, you do not need a facelift procedure. Why? Because you will notice very little change in your face before and after you've had that surgical procedure if you're less than 30 years of age. Second misconception about facelift surgery is I have to have a deep plane facelift. And you know what? 90% of you do not need a deep plane facelift because there's increased operative time, more risk to the patient, increasing complications, and unless you're more senior in your aging state, totally somewhat inappropriate because of the increased operative time and complications. Third thing is are the incision lines going to be visible? And all I can really say to you about that is if you've got a surgeon who's very meticulous in their closure, and typically, if they're not using staples, you get a better incision line result. And finally, who's an appropriate candidate for facelift surgery? And the most appropriate candidate is someone I can stand behind, tighten the face up, and it's a discernible difference to not only me, but the patient. And we can see patients when I start to pull their face up and back, and they will typically say to me, yeah, I do that 2 or 3 times a day, and that's why I'm here. I can see the difference right up front. And what you see is what you get when we're doing that. Computer imaging for facelift surgery does not help, but the best thing to do is stand in the mirror, pull your face back, and see if there's a difference. And if it's a big difference, it's a go. If there's minimal difference, wait another 5, 10, 15, 20 years. If you want to address the aging face, give the Younger Facial Surgery Center a call, and we can address this for you.